Hi, I'm Jazimin. I'm a physiotherapist from Protek Hospital. So I decided to volunteer this Project Aasha because I thought it would be quite interesting to do physiotherapy in a country that I've never been, especially in a rural setting, somewhere in Nepal, in a place called Bung, and which I've never heard before actually. So when I heard about this, I thought, well, why not? Since I've been working for quite some time, I've seen so many things in Singapore, and I'm also interested a bit in global health and chronic disease. Why not just look at what Nepal has to offer? What I like about Project Aasha is that there's a good collaboration between different medical professions. So you have the doctors, the medical students, the physiotherapy students, physios like me, and also we have a sonographer. And it's good that we learn how to work with each other. More importantly, I like that the students, both sides, the medical students and the physio students, are able to see what each other's roles are. Because sometimes, as this opportunity is quite rare, and if you were to go back to the hospital, we don't have much. Some lack of communication may be an issue. So it's nice that if you so-called start young and know each other's role as a student, so that you have better relationship, better bond, and that can be built when you go to the hospital setting and when you start to see patients, because by then you already know what each other's roles are. So my role mainly here is, other than providing physiotherapy services and some general exercise prescription for musculoskeletal conditions and a little bit of chest physio here and there, because this morning we had a patient with COPD. I also helped with Prof Lester to supervise some of the students in their clinical reasoning. So we actually get all the physiotherapy students to do most of the work over there, just to guide them in their clinical reasoning, in their subjective objective assessment, and the whole flow of the physiotherapy visit. Because me and Prof Lester, we felt that it's really very important for us to really groom the future leaders, future physiotherapists. So instead of just us working, we really took time to really get together and supervise the students so that they can become better clinicians in the future. So yesterday we did some general exercises at a very nice open place at the helipad, and today we taught a few things. So we started off with some maternal health education. So we talk about pelvic floor exercises to treat patients or either clients with incontinence issues. Some simple glute exercises, some simple bridging, because apparently most of them, they're not quite sure of the concept of exercises, and they actually don't know that you can actually exercise your pelvic muscles and to prevent or at least limit the amount of incontinence you have. After that, we went through some upper limb, neck, lower back and lower limb musculoskeletal conditions and some simple stretches and exercises that you can do. So you see most of them over here, they are quite hard labourers, so a lot of muscles tend to be very stiff, very tight, and when they have pain, they may not be moving as much as they can. But actually with that, tell them exercise is really important, you actually need to move more. But of course, we need to tell them what are the exercises that they need to do. So it's not just about moving, but rather what and how to move. So some simple neck and back stretches just to relieve the tension of their lower back, and some simple conditioning exercises so that they can better do their jobs, so that the lower limbs and the upper limbs are all strong enough.